Estes here from Innovative Endodontics. Today I want to talk to you briefly about how to prepare for a root canal. A lot of people have heard some things about root canals and think it's a big deal, but it's truly not, and we'll be happy to answer all your questions and make sure you have a wonderful experience. So first and foremost, let's talk about why someone might need a root canal. Well, it really all comes down to bacteria. The inside of our tooth has some soft tissue in it called pulp tissue, and that tissue is supposed to remain in a sterile environment, meaning no bacteria gets in there. However, if we do have a deep cavity or a deep filling, bacteria can get into the tooth and start to cause some symptoms like temperature sensitivity, biting, tenderness, and throbbing and aching. So when that happens, unfortunately, our body can't tolerate that, even with antibiotics, and the only way to save your tooth is with root canal treatment. But the great news is that a root canal is really not a big deal, and it's kind of like a filling. So when we do a root canal, what we do is get you super numb, of course, and then all we're doing is removing the soft tissue that's on the inside of your tooth. So we clean out that soft tissue, use lots of antibacterial rinses, and then we put a filling material down in the root length of your tooth. So some people might ask, is a root canal painful? And truly it is not. We are here to get people out of pain and not cause pain. And so we ensure very, very good anesthesia, and we have all kinds of techniques on how to do that best. So we'll make sure you're very comfortable before we start treatment. Some people also ask, will I be tender after treatment? And there is a little bit of soreness after a root canal, but it's usually quite mild and tolerable and treated with over-the-counter medications like ibuprofen and Tylenol. So people also ask things like, well, can I go back to work? And absolutely you can. You should be able to go back to work. Of course, you'll be numb for a few hours when you leave here, but you should be able to return to normal function. And then the most important part about after root canal treatment is to ensure you return to your general dentist. Typically, when you leave here, you will be in a temporary restoration, and your general dentist will have to place a permanent restoration or a crown on the tooth. So that is the follow-up that will be needed. And then oftentimes we like to do a 1-year follow-up here at our office to ensure that you're healing appropriately and doing great. So that's all there is to root canal treatment. We'd be happy to take care of you here at Innovative Endodontics. Let us know if you have any questions. Thanks.